Hi everyone, welcome to our Movement Freedom Through Fitness webinar. I am Dr. Armour and we have Dr. Phil joining me this afternoon.
Yes, we've got a lot of topics to discuss here. Dr. Armour and I will be discussing the most common troubles with exercising as one thing.
So we've noticed that a lot of people come into our office and they have the right idea of exercising and they are currently exercising, but they've been injured. So you want to make sure that we give you the information that you need to put effort into exercise that's going to pay off and give you the health benefits that you need rather than hurt you.
Yes, we're also going to be talking about the scientifically proven and tested exercise that's so effective. It's been tested by hundreds of thousands of people.
The best part is that we have a 5-minute and a 12-minute exercise routine to share that gives you the biggest bang for the least time or buck that we know of.
Yeah, it's one of the common problems people say is they don't have time for exercise. We're going to squash that. It's such an important topic. All of the health benefits that one gets from this type of exercise, and it can literally cost you nothing. I want to give you some stats here. Cancer researcher and neurosurgeon Dr. Russell Blaylock describes how exercise has been shown to prevent cancer as well as reduce the incidence of cancer recurrence. And then Dr. Mark Houston lists 18 reasons for doing the metabolic conditioning exercises that we are going to recommend. And those 18 reasons, there's a lot of reasons, Dr. Armour.
Oh yeah, so we have a book available for you to borrow. It's called What Your Doctor May Not Tell You About Heart Disease, and it discusses those.
Yeah, so like reduce risk of heart attack and lowering your blood sugar, preventing diabetes and actually help reverse it, reduce risk of stroke. He talks about the cancer, like Dr. Blaylock. He talks about depression, stress, anxiety, overall psychological well-being, improved sleep, energy, and that's just a few. You can see the complete list on our resources.
And we have some more amazing news. You actually don't have to spend thousands of dollars to get the right type of exercise. What we're going to show you costs very little, and you can do it without any equipment. So it's going to be body weight. Again, we'll tell you about that, and we'll share some amazing results with you as well.
Well, we've got an amazing mission, and exercise is one of our 5 fundamentals. Our mission is really to empower you to live a longer, healthier life through our chiropractic care and the integration of the 5 fundamentals.
So today we're discussing exercise as a fundamental, but if you go on our website, you'll see information and webinars for the other fundamentals as well. So if you look at the stats today, Dr. Phil, do you think we're exercising more and getting healthier as a nation, or do you think we're getting worse over time?
Oh, we're definitely getting worse. The rates of disease are skyrocketing.
Yeah. So if you look at childhood obesity in Canada, it's tripled in the last 20 years. For adolescents, it's actually tripled as well. And when you look at where we rank in terms of world obesity, we're number 4.
That's sad. And a lot of the Canadian stats are showing 1 to 2 kids out of 10 are now exercising as recommended by the Canadian or national guidelines.
So what's the problem then? Because most people know that exercise is good. They know they need to do it, but they don't do it, or they're doing it incorrectly. So there's a lot of information out there, and people feel really overwhelmed, and they decide, you know what, it's easier not to make any changes now. There's just so much information out there, and you can actually find support for anything. You can find good support for slow walking around the block. You can find good support for, things like CrossFit, but it might not necessarily be the correct information. So that's why we're doing these types of webinars.
We're going to talk more about the type of exercise and the most important bang for buck coming up.
Right. So it's not the lack of access to information. It's just there's overload and there's just too much out there. So exercise is actually essential for it's a fundamental. We need to do it, and we have a genetic requirement for movement.
Yeah, so Dr. Mark Houston and Dr. Blaylock, again, they talk about this, and you'll have that on your resources. Helps cancer, autoimmune diseases, neurological diseases, depression. Not only does it help prevent, but it helps actually reverse them, which is key.
So what happens is if someone's physically inactive, it causes metabolic dysfunction, and that over time creates metabolic disorders. And this, we've helped so many people reverse, like Dr. Phil has already mentioned, reverse disease, not have it in the first place. And again, it is possible. So again, we'll be sharing more information on how to do that.
Yeah, this exercise is called metabolic conditioning because it actually changes your metabolic rate. and how your body can make new cells in your inside every organ, tissue, and cell in your body.
So let's address the first myth, Dr. Phil. The first myth is exercise heals the body. What do you think about that?
Oh boy, is that ever a big one? So, my uncle Bob, he passed away at 58, and he was one of the most fit people I know. People tell me about, Jim Fix, the marathoner, and we're going to talk about why this type of exercise is not the best, and just if somebody could be classified as fit in a certain activity, that it doesn't necessarily mean they're healthy. Dr. Blaylock talks about that, and he says, if you exercise the wrong way and you go too hard or too long, you'll actually decrease your immunity and be more prone to cancer. Dr. Houston talks about being more prone to heart disease and having metabolic disorders and so on.
So we want you to understand that exercise alone, just itself, doesn't actually, make someone necessarily healthy. We're exercising to bring oxygen to our cells, and that's the main purpose of it, but you need to follow the other fundamentals as well in order to truly be healthy. So if you think of people like Dr. Phil was saying earlier as well, someone like Lance Armstrong, he was one of the fittest people. That's what a lot of people would think, but he still got cancer. So why does that happen? Again, so we can't just rely on exercise alone and say that I exercise, therefore I'm healthy.
Right, and that's where it comes into our specialty, which is chiropractic. And so, Dr. Armour, is your body like a car or a bike?
So this is just it. Your body is in part like a bike or a car, Dr. Phil. So let's elaborate on that.
Well, mechanically, you're right. It is, and everything needs to be lined up for your bike if you want to ride optimally, or your car if you want them to be lubed up and increase their performance, and of course minimize wear and tear in your vehicle. Wear and tear in your body is really called arthritis. And so what we're going to do is we're going to show people exactly how to do their joint warm-ups and to align their body, especially their spine, at the art of exercise. And it just takes 3 minutes. I do this personally every single morning, and I know you do yours too. There is one major difference, however, in the spinal joints as compared to the knee, the hip, the shoulder. Their joints too. So, Dr. Armour, a lot of people ask why you can't replace a part or all of your spine like you can get like a total knee or a hip replacement. They usually don't know why.
So, Dr. Phil, the reason we can't replace a single spinal joint is because everything is connected in the nervous system. So every message starts from your brain and it travels down the spinal cord and it goes out into all the cells, tissues, and organs. So if you look at our spine, or our nervous system, it's completely encased within bone. So our brain is surrounded by our skull, and our spinal cord network is surrounded by the spinal joints. And that's how every single cell knows what it needs to do in order to survive. So if there's a single area in your spine that's misaligned, what that does is it puts pressure and it disrupts that nerve flow at that level. So then your brain can't communicate with those corresponding body parts like it's supposed to. And that's exactly how we help as chiropractors, because when we can fix that pinched nerve, that subluxation that we refer to as, or restore the movement within that joint, it allows your body to actually communicate, or it allows your brain to communicate with your body like it's supposed to, so you're actually building health rather than disease. So Dr. Phil is actually going to share a personal story about that.
Exactly why I'm a chiropractor today. I get excited about this. My motion in my spine and my alignment was off, but I had no pain. My MD hadn't detected it by the point I was 16. It was my mom, who was a nurse, who actually noticed that my alignment wasn't right. And that's when one of my parents' friends, who they took their whole family to the chiropractor for regular checkups, said I should go. Nobody in my family had gone at that point. Well, that totally changed my life. I went from having asthma for 9 years to not ever even using puffers again in just over 2 months with chiropractic care. And that's because they, like Dr. Armour said, they worked with the movement of my vertebrae and the alignment improved in my spine, and it allowed those messages to get through properly. I mean, I used to get so many colds, bronchitis, pneumonia. I was off school frequently. And now in 26 years of chiropractic, working as a chiropractor, I've only missed 1 day. And that just speaks to the potential of health that you get when you improve your movement of your spine and the alignment. And that's why we say the power's on. But you know what? The biggest thing that I didn't know at the time was why my spine didn't hurt when I had a problem, Dr. Ummer.
So the reason that you didn't feel the pain is because you only feel the pain 10% of the time when there is a pinched nerve there. So the thing is, we always say you don't want to wait until you feel pain. Be proactive and get your nervous system assessed before you actually feel pain, because when we start having symptoms, it's basically our body saying, wake up, pay attention, something's wrong here, and take care of this now. The other thing that we believe is that there's a misconception about how chiropractic treats conditions, but that's not what it actually does.
You know, that's a great point. We don't treat any condition. Some people say, you know, we cure back pain and headaches. We don't. The only reason people's symptoms resolve and their health improves, like we got people that have gone off blood pressure medication, cholesterol medication, diabetes medication, and so on, is because we actually get to the cause of why that is the case, because we get the spine moving properly and correct the alignment and allow the brain, the only thing that knows how to take food that you eat and make a liver cell or a spinal bone or a heart cell from that same food, and we get it to replace damaged cells with healthy cells. I mean, it's the only thing to heal fractures, to fight cancer cells, is in fact your brain. Your body is an amazing machine. So our treatment or adjustments and corrective exercises allow your brain and body to work properly. And you know, that's why taking pills for a spinal problem will never fix anything either. They'll temporarily relieve symptoms possibly, and they could even make things worse, Dr. Ummer, because you know, I'm playing hockey and golf with people, guys like getting my age, like over 50, and what's happening is they're popping pills before they play their sports, and I really believe that's dangerous.
Right, so if you're doing all these exercises but you don't have the proper spinal alignment that you're supposed to have, you're actually going to cause wear and tear in your joints, and that's going to strain muscles that are connected to these joints, which will cause further damage. So the only joints in your body that you can't really replace are your spinal joints. So this is why we say you have to make sure you're taking care of your spine and maintain your spinal health. Now, Dr. Phil listed some symptoms off. Like we've helped people get off of certain medications, cholesterol medications, and heart disease, other things like that. But there's a lot of other symptoms that people come into our office with, such as asthma, headaches, menstrual problems, high blood pressure, depression, insomnia. Numbness and tingling is really common. Neck pain, dizziness, acid reflux. So when we see this, again, what we always say is, let's have your nervous system assessed, because if there's blockage in that nerve flow going to organs such as your stomach, then you're more likely to have symptoms such as acid reflux. So when you do have those symptoms, we know that there's damage that's been present for a while now. So that's why we want to get to the cause of why you're having those symptoms and address that cause.
There's so many people, Dr. Ummer, that they think I'm going to start getting healthy no matter those conditions that you listed, and they start exercising and their condition actually becomes worse. Mm-hmm. And I like the analogy of like hammering a bent nail. So if you're exercising on a spine that's not right, you're going to aggravate symptoms and possibly disease.
So we'll be sharing more information about this when we have our next upcoming workshop about the art of exercise, and our upcoming webinars as well. So make sure you stay tuned for those.
And that's going to be a live demo, right?
Yeah, so we're gonna give you the opportunity to actually see how we do these exercises and how fun and interactive they can be as well.
Are you and baby going to be exercising?
Well, yes, we already do. Okay, so the next myth we're going to talk about is how it doesn't matter how hard I work because I have bad genes. And because my parents were sick, I'm going to be sick. So we find that a lot of people have this mindset, and this is actually one of our fundamentals. Your mindset has to be, it has to be there. Otherwise, it's hard to do anything, whether that's exercise, go to work, eat right. And if you actually look at the research now, Dr. Phil, what % of the time can you actually blame genes?
It's so low. It's 5 to 10% at most. And we got a stat that we'll share coming up with that. And so there was a study done with twins to eliminate genetic factors. And when they found that the one twin did regular exercise, it actually reduced their chance of dying by 66%. So you'll have that in your resource section. That means that genetics, played a very minimal role. That's just exercise. Never mind any of the other fundamentals. Just exercise alone.
Right. So that's just it. You can't blame your genes. And what actually turns good genes on and bad genes off then? What is it? What's the answer?
Yeah, so it's your lifestyle. And so Dr. Ornish did a study where he took people with prostate cancer and he actually found that 3/4 of their genes that were programmed to be genetic for cancer, that is, the gun was loaded and they were going to create cancer cells, that they actually reversed in just 6 weeks of changing their lifestyle, including exercise.
So this is what we always ask you when you come into our office. What's the reason, why do you actually want to be healthy? What's your big why? So you have to have something to anchor to so you can actually achieve your goals. If you don't have, if you haven't figured that out, it's hard to keep anchored and stay on track with your goals. So if you're just saying, I want to feel good, that's great. But if you look at things long term, you want to make sure that you're not in the nursing home down the road, because if you look at the stats, more and more Canadians are getting sick. So let's work on all 5 of the fundamentals so you're actually building health rather than disease.
Awesome. So, we have a genetic requirement to move. It's not like it's a fun thing to do or it could make you healthy. In fact, if you don't move and you don't exercise, you're going to be unhealthy. That's just the way it works. We didn't make these rules. So, going to the gym, Dr. Emmer.
So again, the next myth is I need to be in the fat burning zone as long as possible to lose weight. So if you go to the gyms, and I used to do this as well, I would put the treadmill or elliptical on the fat burning zone, and I would work out for an hour and a half, and I would say, okay, this is what I need to do to actually burn that fat. So this is a flawed way of thinking. Metabolic conditioning is actually the correct way to burn fats, not doing these pre-programmed, cardio, high fat burning zone types of workouts, because they're not tailored to what your body needs. So it's not just about burning fats while you're exercising, it's actually burning fats after your workout. So most people don't understand that. So I'm not sure about you, Dr. Phil, but would you rather do, a 15-minute high intensity metabolic workout, or would you rather walk on the treadmill for an hour?
Yeah, that very point. The story that I told you a few times is that this one guy, I used to work out at the Whitby Civic, and he would be on the treadmill, running, walking for over an hour. And this guy had like a pot belly. And so I asked one of my buddies, I went back like 5 years later to work out with a friend. And I said, has that guy been here all these 5 years? And he said, absolutely every day. And the guy still had the same pot belly. So the proof's in the pudding, as I like to say. And that so-called fat burning zone, it doesn't actually burn fat, really, just for a short duration. And we're going to explain that.
Yeah, so how you utilize fuel in your body will actually depend on how you exercise.
So, this is where we talk about the marathoner versus the sprinter. And so it's very interesting. I go back to Dr. Blaylock, and he's the cancer neurosurgeon, and he says that marathons, Ironman contests, intense aerobic exercises that are of long duration, so that's our beef with CrossFit, really, is that they're not good because they can rapidly deplete the existing antioxidants, suppress your immunity, and they actually cause breakdown of muscle tissues, and I would have to say joint tissues as well. I think when you start losing your technique because you're fatigued, and then you're going to put damage into joints and muscles and really cause the trouble that people are coming in with when they're trying to get fit and healthy, but they're doing it wrong, in our opinion.
You're right. So we see this in our practice commonly. We see people come in there, they tell us about their workouts, and then when we feel their spine, we know that they've overloaded their joints and it's actually not healthy. So then we'll give them modifications. So if you look at this slide here, the afterburn effect. So with classic cardio, you're sweating during your workout, but you pretty much stop after that. The sweat stops coming. With metabolic conditioning, you're not sweating as much during. Sometimes you are, but you sweat a lot after. So you'll notice too, sometimes when you're taking a shower and you get out, you're still sweating. And that's actually a really, really good thing, because that means that you're actually burning the toxins. You're getting rid of the bad fat out of your body. And that's what you want to be doing essentially, rather than, just go to the gym for an hour and only get some benefits for that 1 hour. You're getting the afterburn for over 30 hours afterwards.
Yeah, and scientifically, if you want to look that up, that's called the excess post-exercise oxygen consumption. We just call it EPOC, and that's what happens with our perfect solution, the 3 T's of Max T3. You vary the time, type, and tempo of the exercise. So the time is usually 12 minutes. Now we have a 5-minute version to work yourself up to it. It's shorter if you're just starting to work out, and that's what we'll be explaining at the Art of Exercise. on the August the 15th. And so then the Max T3 will be going over that in detail. We'll do the 5-minute exercise, and we'll actually do a Max T3 workout. Now we do have a challenge coming up as well.
So stay tuned for that. So the amazing thing is that this is a perfect solution for everyone. So sometimes we talk to people about this and they're saying, I'm immobile, I haven't worked out for years. And what we say is sometimes you have to get fit to get fit. So if you haven't worked out for years, you go as hard as you can initially, but you'll notice even within a week or two, you'll be able to put in more effort. You'll be able to work out harder. So everyone has a starting point. And we adapt. We make sure we have programs or recommendations where you can adapt to that. So please talk to us about that if you are concerned. But this is the basic solution, perfect solution for everybody.
Yeah, and then like Dr. Blaylock says, you're not compromising your immune system or your joints in your body. You're going to just provide healthy solutions because the time is slower. The type is so metabolic conditioning, and the tempo is so that you don't get hurt, and your technique is very important.
So with metabolic conditioning like Max T3, what we're doing is we're actually burning fat and we're building muscle. So that's anabolic. But when we're doing typical exercise like walking on the treadmill, we're burning muscle and we're actually storing fat. So it's not doing anything close to what we think it's actually doing. So metabolic conditioning has a lot of benefits. It optimizes hormones. So that's really important because we know we're exposed to a lot of toxins, whether it's in our food, products that we use on a daily basis, where we're having a lot of hormonal issues. So you want to balance those hormones. You're burning the fat, you're building the muscle like we're saying, you're regulating your blood sugar levels, which is amazing. You're increasing your lung capacity, and like we said, you're improving your overall health with all the other fundamentals as well. So what happens if I only have 2 minutes to work out, Dr. Phil, or 5 minutes to work out? What do I need to do?
Well, that's what we're going to talk about at the Art of Exercise. And the challenge on the August 15th will be, you'll be getting that challenge. We're going to be talking about that. But if you only have so much time, we're going to go over, you have 3 minutes to work out, this is what you do. You have 5 minutes, this is what you do. You have 12 minutes, this is what you do. And in fact, the Max T3, there's enough workouts with that type of exercise that you couldn't actually do the same exercise more than once in a year. That's how many different, we're varying the time, type, and tempos, and that's all online.
Yeah, but the basic line, or the bottom line is that you want to make sure you're breathing hard and you're actually burning the fat. So if you're standing next to your friend, and I've had friends do this where they come to the gym with me and they want to chat for the 30 minutes that I'm in there, you're not working out hard enough. So you'll notice with the Max T3s, it's hard to have that conversation.
Yeah, the EPOC principle that we talked about, it shows that, and I'll just give you an example of the sprinter versus the marathoner type, is that marathoner can't store as much of the blood sugar in their muscles as glycogen, so it actually gets stored as fat. So that's why the guy on the treadmill could have a pot belly, and the sprinter is not likely to have it, because the sprinter can actually store the excess blood sugar in a molecule called glycogen, instead of the marathoner can't, because he's been working out differently. That's what is known as metabolic conditioning. So you're going to get lean, stronger muscles, not necessarily bulky, but stronger, and they will store more glycogen, and you will be able to eat some what we call holiday vacation day foods, and so-called get away with it.
So the next question that I have for you is, Dr. Phil, do you sweat when you work out?
Yeah. Is that gross?
No, not really. I'm going to tell you why. Sweating is really good because it allows you to eliminate the toxins out of your body. So whether that's detoxifying to your skin, livers, kidneys, you want to make sure that you are sweating. And if you're not, then that's a concern for us. We want to make sure that you're able to do that, because what does that actually allow our body to release, Dr. Phil?
Really important, the toxins, especially heavy metals, phthalates. We talked about this at the other seminar with the toxicity. Right. These phthalates and plastics and all sorts of different things that we're consuming on a regular basis. We need to take that stress off our liver and kidneys, and we need to exercise with sweat to detoxify. That's the biggest deal, I think, that Max T3 does, or metabolic conditioning does, is, like you said, you're going to sweat for long after your exercise doing this kind of exercise than if you went for a run. Yeah,
so sweating not only does that, but it improves blood flow, it reduces your blood pressure, and it improves cognition. So again, a lot of benefits of the sweating as well.
Aren't you smart?
So
What about showering?
so this is the other thing too. You want to shower once you're done sweating and you're done your workout, which I'm sure everybody does. And the reason being is, again, like Dr. Phil has mentioned, there's so many toxins that are excreted through our skin and our different organs. So you want to make sure you're washing them away. So don't just do a quick wipe. Try your best to actually get in under some water and use cold water, because that helps remove the toxins even better. And we know some of you take walks and you sweat during your lunch break. Again, just, if you wipe your face, or you do get some sort of towel and you give yourself somewhat of a wipe, that's better than not wiping anything down.
Agreed. There's some people that can't sweat, Dr. Armour, and so we say, hydration is one of the keys for sure. And so just to give you an example about how much water to drink, so say a 200-pound person needs 100 ounces, which is 12 and a half 8-ounce cups of water.
So that you need to drink half your body weight in ounces. So,
right.
Yeah, so make sure you're doing that.
That's perfect. So do you have any takeaways?
So we want to make sure you have to push if you're only working out for those 12 minutes. So what we say is you want to be in your target maximum heart rate zone. So what we want to do is we want to take 220 and then subtract your age from that times 80%, and that's what your heart rate should actually be when you're doing these high intensity workouts. We can help you figure that out. Again, you shouldn't be able to have a conversation when you're doing these high intensity workouts. And we always say it's good to come to these classes and workshops that we do, because it's always easier to stick with the workouts that we like doing, because we're comfortable doing these exercises. But you want to get out of that comfort zone and try something harder to challenge yourself, so you're actually, again, your body's not getting used to your workout routine that you've been doing for months or years now. The other thing is you don't want to sabotage yourself after you exercise. So we didn't talk about this much during this workshop, but we have a lot of resources about this on our website. You want to avoid foods that are high in sugar. So don't go home and say, okay, now that I've done that amazing workout, I'm going to go have McDonald's. Doesn't make any sense, because you've defeated what you've just done, and it doesn't make up for all that garbage you're going to expose your body to, basically. So you want a proper good fat diet and moderate protein and then low carbs.
So we've got a challenge for them, Dr. Armour, and just since you're talking about the foods to avoid, what about supplements to help?
So again, this is something that a lot of people buy supplements that are full of toxins, so they actually add to your toxic load. So you want to make sure you're buying, whether, if it's whey protein, it's coming from cows that are grass-fed, they're not given any types of antibiotics or steroids. Or you can supplement with something like a plant protein that's organic. So that's something that we're going to talk about again in our upcoming workshop, which will be on August 15th.
Yeah.
So we have options available in our office. You can go on our website and you can see the supplements that we all personally use once we're done our workouts, or just on a daily basis.
That's awesome. We got a movement challenge for them. So we've got 30 days that we have specific exercises. It starts off pretty easy, and then it works up nice. Yeah. And I think they're going to be challenged on this exercise. That's August the 15th, 2018, right here at Welcome to Wellness. We'll be doing the joint warm-ups, and we'll be doing the day one of that challenge at the Art of Exercise. We'll be answering any of your questions that you had from this webinar, or any questions that you have in general about movement or exercise.
So we want you to come to these events. We want you to bring your friends, bring your accountability partner, because that's how you're going to be anchored to your big why, and we'll make sure we keep you on track, and your partner keeps you on track as well. We have some more upcoming events as well. So we have Max T3 exercise class. So that will be held on Monday, August 20th at 7 p.m. So you're going to do that full Max T3 workout with Dr. Phil and Glenn. And you'll see how fun and how fast it actually is. We also have yoga with Judy. So that'll be Thursday, August 22nd at 7 p.m. Qigong with Donna Elliott on Monday, August 27th at 7 p.m. And then Flow Fitness with Karen. So that will be August 29th at 7 p.m. So you can sign up for all of these workshops on our website. So please go ahead and do that when you get the chance. And again, bring your, even kids. If you bring kids, it's great, because kids need this exercise as well.
Absolutely.
So kids, family members, coworkers, anyone you want to bring, make sure you bring them to these events. I
think personally that people will be coming to this event and bringing it back to their workplace, hopefully to different groups, sporting groups. We're going to be discussing, a proper dynamic warm-up for those that are in sports groups. and how to actually prepare properly for your soccer or your hockey or baseball or whatever. Most people just go right into the activity, and we're seeing kids getting problems with this. One of the other reasons why we wanted to have people that we know, for instance, for yoga, for the flow exercises, and all the other ones, is because for our wellness members, we work with the people that you're working with. And if you don't have somebody that you're currently working with, we'll make a recommendation, because we know that they know about spinal health. And we know that they're going to help optimize that exercise. One exercise might be good for one person, but might be totally harmful for another. And that's just because their movement or their alignment of their spine and their other joints may not be correct. And so they can modify that exercise for that person if they know. And most instructors, they'll work with us. In fact, everyone that we've contacted will work, because they want your health to be better. And when they understand what your spine looks like, they're going to make those changes to help you.
So we'll see you guys at our next event then. That'll be August 15th, The Art of Exercise. And if you have any questions, please do email us at team@welcometowellness.ca. If you have any feedback, please leave that as well. And we're going to make sure that you can share this video with others as well. So have a great day.
Awesome. Have a great one. See you at The Art of Exercise August 15th and the Max T3 August 20th.